Aloha. Thank you for joining me today. I'd like to welcome you here. My name is Dr. Catherine Taketa-Wong, and I'm a naturopathic physician and acupuncturist. And for those of you who aren't familiar with naturopathic physicians, just a quick introduction. So like medical doctors, we have to attend a 4-year medical school, and we're trained as primary care physicians. And as such, I can order lab tests, write prescriptions, and do school physicals, just like other doctors. However, a big difference is that naturopathic doctors are trained in the power of nutrition to build health from the inside. And I use personalized food recommendations, vitamins, herbs, and other types of natural medicines to address the underlying causes of disease and treat the whole person. I also have a master's degree in Oriental medicine, which allows me to include Chinese medicine and acupuncture in my treatment protocols. So before we begin, I just want to let you know that if you have health concerns that you would like to talk with me about, we offer a no-charge phone consultation called the Personal Health Strategy Session. This is a 15-minute strategy session where we talk about your condition and come up with a plan to see how I can help you the most. So arranging a consultation is very easy. Just call our office at 808-425-2987 and let our staff know that you're interested in a no-charge phone consultation. So let's get started, and please feel free to use the comment sections to ask questions as the talk progresses. So today I'm excited because we're going to be talking about a very important topic, and today we're going to be touching on the differences between conventional and naturopathic medicine. And it's important because when you're dealing with an adverse health condition, you want to know the best approach for helping you to be able to get better. So let me just first begin by saying that I believe in both conventional and natural medicine, and that they have very vital roles to play. I do use pharmaceutical medications with my patients when necessary, so it's not about saying which is better. It's just about understanding the differences so that the choices that you make are better informed. And, you know, when people have urgent conditions, like, for example, if they're having a heart attack, I'm like, don't come to me, go to the emergency room. So conventional medicine is very good in terms of, I would call it what I call sick care, or taking care of us when we're very severely ill, or they're very serious illnesses, life-threatening kind of illnesses. It's very good at that. But there are a lot of chronic health conditions that conventional medicine doesn't always do the best job in terms of treating that. So, and we'll talk about some of those differences. So just to give you a little bit of my background, once I decided to become a doctor, I had a choice to make. So as a young girl, I knew that I wanted to be able to help my brother who is on the autism spectrum, and that I wanted to help children like him. And so as I grew older, I actually did my bachelor's degree, my undergraduate degree in speech pathology, because my brother had a great speech pathologist, and I thought I would go that direction in terms of helping children. But as I learned more and more about autism, I started finding out about research that there are actually many medical conditions that are underlying the symptoms of autism, and that to really be able to treat the cause, we really need to address a lot of those medical issues. And so at that point, I decided that I wanted to go into medicine. So what I found was that when I was considering going to a conventional medical school, and I had decided I was going to go into medicine, but as I looked more at the curricula, I found that in conventional medical schools, they weren't really teaching a lot of this newer research about autism and the medical conditions and how it could be treated. And as I learned more about naturopathic medicine, I found that naturopathic medicine, that they did have coursework and pathways for being able to apply and use this newer research in terms of treating children with autism. And also just the whole philosophy of naturopathic medicine really made a lot of sense to me because it was more about figuring out what were the underlying causes that were underlying the symptoms of autism, and treating the underlying causes rather than just treating the symptoms. So that was really why I decided to go into naturopathic medicine, was because again, the philosophy resonated with me, and it offered me a pathway to be able to help children with autism by addressing these underlying medical causes. So let me tell you what the biggest difference is between conventional and naturopathic medicine. So there are a lot of differences, of course, but I would say that the biggest one is that conventional medicine tends to be focused on treating just the symptoms, while naturopathic medicine is really about treating the whole person. Because we aren't just a bunch of symptoms. We are people with a history, with emotions, and with a body where everything is interconnected. And so that's why the conventional route is focused on pharmaceutical and surgical interventions that primarily address the symptoms, whereas naturopathic medicine is really trying to figure out what's happening inside the body that leads to the symptoms, and then seeks to bring the body's organs and other systems into balance to address underlying causes of those symptoms. So one of the things that I want to talk about is looking at how there are different systems in our body that are interrelated. And that's really part of treating the whole person. So to give an example, for example, if someone comes in with a skin condition like eczema. So some of you, if you've suffered from eczema or other skin conditions, you may be familiar, you might go in to see your primary care doctor, or you might go to see the dermatologist. And typically what they might do is prescribe a steroid cream. So it's a cream that suppresses the inflammation that you put topically on your skin, but it doesn't tend to be a very good long-term fix, because I've had a lot of patients that talk about, well, you know, I have eczema, I went to see my dermatologist, they just give me steroid creams, and, you know, if that doesn't work enough, then they give me stronger and stronger steroid creams, or they might give me an oral steroid medication to take to suppress the inflammation. So again, it's focused on the symptoms, which is the rash, the eczema that's coming out on the skin. But when we really try to figure out what is the underlying cause, one analogy that I give is that if you have a bunch of flies in the room, you can keep trying to kill the flies and use bug spray or a fly swatter and try to kill the flies. But if the reason that the flies are there hanging out in the room is that there's a bunch of trash in the room, then you really need to take out the trash, and then the flies will go with it, rather than constantly trying to just swat at the flies and kill the flies. Because if if there's trash, then there are more flies that are always going to keep coming until you take the trash out. So applying that to this case, when I talk about eczema, in naturopathic medicine, I take a very different approach to treating someone with eczema, for example. So in naturopathic medicine, I talked about that there are different symptoms that we recognize are connected. So in naturopathic medicine, we recognize that there is a really big connection between the skin and then the gut, or our digestive system. And very often I find that when people are having problems with eczema, very often that can be a sign that there can be imbalances in the gut. Some of those things might be, for example, that there's something that someone's eating that they have trouble being able to digest or break down. Or maybe they have allergies, or they might have sensitivities to a certain food. And so I'll often test for those foods. And then if they do have a high reactivity to certain foods, having them take those foods out of their diet, or working on a diet that decreases inflammation in general. People also may have imbalances in the gut where they may have problems with not having enough of the good bacteria, or they might have inflammation. Another system that's connected between the skin and is our liver and our detoxification system. So if there are a lot of toxins that have built up in the body, our skin is one of the ways that our body gets toxins out. Our body will push toxins out and express them through the skin. And so sometimes with some cases of eczema, we might need to look at how well is the liver able to function in getting toxins out of the body. And does someone have a high amount of heavy metals or other kinds of toxins in their body that we need to detoxify them? And as we get the toxins and the yucky stuff out, similar to taking the garbage out, then the eczema gets better, like the flies go out. with the garbage. So that's just one example. And another example in terms of treating the whole person is looking at, for example, that there's a connection between the immune system and the gut. So when I have patients that have an autoimmune condition, for example, an autoimmune condition is a condition where the immune system is attacking your own body. So it may be attacking organs within the body. Like, for example, if somebody has Sjogren's syndrome, then what's happening is that the immune system is actually attacking their salivary glands or attacking the glands that make tears, the glands that produce moisture in their skin. And so they have a lot of dry eyes, dry skin, dry hair, and it may actually attack other organs in the body as well, glands in the body. But what we recognize is that there's actually a really big connection between the immune system and the gut. So, for example, when I'm treating someone with an autoimmune condition, the conventional approach is that they will use medicines to suppress the immune system, because the immune system is attacking basically the person's own body. And those medicines can be needed in very serious situations, in life-threatening conditions, or where a person has a lot of inflammation and things are very, very severe. So I'm not discounting the need for some of those in certain situations. But when people come to me, what I do is I'll do an assessment to look at what's the state of their gut, and do they have enough of the good bacteria. And oftentimes, if there are imbalances in the gut, that can cause problems with the immune system. And they found that some of the things that can happen is that the good bacteria in the gut actually talk to our immune system cells, and they exchange chemical messages. So what happens with that is that our immune system is really dependent on having enough of those good bacteria in our gut, because, for example, if we've taken a ton of antibiotics over and over and over again, then that can really kill a lot of the good bacteria that we need. And if those good bacteria aren't there to talk to our immune system cells and to keep our immune system in check, then we can start to get problems with the immune system, where it starts to attack our own body and starts to do things that are out of balance. And so that's a big thing, is that we will try to we'll try to balance out things in the gut, and we often find that that will help with the immune system. Another example of a connection between different systems, and that is that there is a connection between the immune system and hormones. So, for example, if someone, again, has an autoimmune condition, very often we find that there are hormonal imbalances, and not just like the male and female sex hormones. Like when we think of hormones, most people think of testosterone and estrogen and progesterone, and there can certainly be imbalances in those hormones, but there's a number of other hormones like thyroid hormone or adrenal hormones that can be out of balance. And we find that if those are out of balance, then it's really hard to get the immune system back into balance. So what we need to do is we need to balance out the hormones, and then we find we have better success with balancing out the immune system. So those are just some examples of how naturopathic medicine really looks at the connection between different systems in our body, and really tries to connect those two, rather than just focusing only on the immune system or only on the skin. We're looking at a lot of different things. And another thing that flows from the focus on treating the whole person is the amount of time that I spend with patients. So my new patient office visit is an hour and a half, and my follow-up visits are 1 hour. And as my patients will tell you, that often isn't enough. There's so much that we're usually trying to go over and cover in that 1 hour. And most of that is all time one-on-one with me as a doctor. And one of the things that I need in order to really be able to do this type of medicine well is that I need more time with my patients, because most people go to the doctor and you might see a medical assistant or a nurse who gets your vital signs. They step out, and then the doctor comes in and you talk to the doctor for maybe 5-10 minutes, maybe 15 minutes at the most. But when I'm looking at treating the whole person, I'm really acting as a medical detective. So I'm looking at connections between different systems in the body, and I usually have to ask a lot more questions to figure out what could be going on inside of the person and what are the connections in terms of the different systems in the body, and how do we address these underlying causes rather than just trying to treat the symptoms. Another thing is that I typically order a lot of lab tests because when I'm trying to find out the underlying causes, I need to know what's happening in the body. So I typically tend to order a lot more lab tests than a conventional doctor might, because I'm not, again, just looking at the immune system or the skin. I'm looking at the digestive system, or I'm looking at the hormones, or these other kinds of things that can be affecting the main system that is the symptom of concern. And another prime tenet of naturopathic medicine is that they emphasize the role of the doctor as a teacher. And so we really take seriously the idea that we need to spend time educating our patients about what's going on inside of the body, what different medicines are doing, how they work in the body, and what they can do to be empowered to really be able to take charge of their health so that they can really get better. And in my role as a teacher, I want to take time to explain to my patients what the tests mean, what different herbs or other medicines I'm prescribing, what they're doing, and then how they can change things in their either diet or their lifestyle to be able to know how they can get better. And so part of my mission is to empower patients to be able to build and maintain the best health possible for themselves and their families. So, and then another example, kind of going back to that example with the eczema, is that I may use lab tests to figure out, for example, are there nutrient deficiencies that could be causing imbalances with the skin? Are there toxins that have built up in the body that we need to remove? Is there an imbalance in the gut where there's an increase of yeast in the gut that is causing imbalances with the gut that's therefore causing problems with the skin? So those are examples of some of the type of things that I might do. And then just to let you know, I will be wrapping up in about 10 minutes or so. Just wanted to remind you that we do offer a no-charge phone consultation if you want to talk with me personally about any health concerns that you have. So just call our office at 808-425-2987 and let our staff know that you're interested in a no-charge phone consultation. So another thing that I like to share is that when we're treating, when we're using naturopathic medicine, we're trying to use, of course, the most natural methods possible. So while I can prescribe pharmaceutical medications, I usually will try as much as possible to use more natural methods. So one of the tenets of naturopathic medicine is first do no harm. So trying to use the least invasive, the least harmful kinds of interventions as much as possible. So that's why usually we'll start with things like diet and herbs and homeopathic medicines and other kinds of things that tend to have far fewer side effects than pharmaceutical medications. And then there's a question over here in the chat from Soledad asking, how do I build up good bacteria in my gut? So that's a great question, Soledad. So one of the things that we talk about are using probiotics. So probiotics are the good bacteria, and there are many, many different types of probiotics. Most people don't even realize that there are many different strains, and that research, when they are looking and studying the effects of probiotics, that they actually really need to go very specific to the strain and the type of probiotic. So people just think of probiotics as a general category, but there are many different strains of probiotics that have been studied for different things. So for example, like Lactobacillus reuteri is one species of probiotic that's been studied to be especially helpful for the vaginal flora. So women that tend to have imbalances in the vaginal flora, but it's also been studied and found to be helpful in autism. and it can actually affect brain function. So that's another example of where systems can be related, where the brain could actually be affected by what's in our gut. So there are a number of other specific types of probiotics that have been studied, and I won't get too much into that, but so taking different kinds of probiotics, but ones that are really specific to the health conditions that you're looking at, that can be helpful. And then also eating fermented foods are helpful for many people. So fermented foods are the natural sources of probiotics. And there are many different types of fermented foods, for example, sauerkraut, miso, natto, there's also yogurt and sour poi for those of you who live in Hawaii or have a Polynesian background. There's beet kvass, which is fermented beets. There's a number of other fermented vegetables like fermented carrots. Kimchi is a fermented food. So there's many different kinds of fermented foods. There are some people who may have trouble being able to tolerate fermented foods, but for most people, fermented foods are a good way to increase the good bacteria in the gut. And so kind of getting back to some of the things that we talked about, I wanted to share a few other examples of how naturopathic medicine might differ. So another example that I'd like to share is with patients with autism. And so there are many patients that I see with autism where they come in, they say, I really, my child was diagnosed with autism. I asked my pediatrician, what can I do to help my child? And sometimes they say, oh, there's nothing that we can do. Or some pediatricians will say, oh, well, you can see a behavioral therapist and have behavioral therapy. And behavioral therapy is very helpful for many children with autism. And there's many other therapies that can be very helpful, occupational therapy or equine therapy, working with horses, speech therapy. So these therapies are important, but there's not very much awareness that there are actually medical conditions that can underlie the symptoms of autism, and that we can do things to be able to treat these underlying causes. And then children with autism can get better. So for examples of those, so there are some children with autism that come in that they're actually very aggressive, and they may be self-injurious, which is where they're banging their heads. They might be using their fists to bang on their heads, or they might be hitting their heads against the wall or the floor, or they may be biting themselves, or scratching or hitting themselves. There are other children who will be very aggressive, where they're biting, hitting, scratching other people. And there's actually a quote from a well-respected Harvard pediatric gastroenterologist, which is a doctor that specializes in the gut, and he sees children, and his specialty was autism. So this is the doctor, his name is Tim Bowie, and he works at Harvard, and he published a study in the Journal of Pediatrics, and he said that per person, this is an actual quote from one of his research papers that he published in the Journal of Pediatrics. He said, for a person with autism spectrum disorder who presents for treatment of a problem behavior, the care provider should consider the possibility that a gastrointestinal symptom, particularly pain, is a factor that increases the likelihood that serious problem behavior, for example, self-injury or aggression, may be exhibited. Sudden and unexplained behavioral change can be the hallmark of underlying pain or discomfort. So what he's saying is that actually many of these children who are aggressive or self-injurious, that they're actually going through pain, and many of them, it can be due to pain in the gut or their digestive system. And so there's many children with autism that I see that they may come in that they're very aggressive or self-injurious, and we have really good success rates in terms of helping them to get better, because some of these children may have acid reflux. Some of them may have colitis or inflammation in their colon or their intestines. Other children have inflammation in their stomach. or the small intestine. Some children may have inflammation in their esophagus or their throat. And a lot of these children, because they may not be verbal, they can't tell their parents, my tummy hurts, or my chest hurts, or my throat hurts. And so they don't know how to express it, and so they get frustrated easily. If you think about when we're in pain, if you or I are in pain a lot, we're not in the best mood. And so for a lot of these children, we have to do some investigative work to figure out what's the underlying cause. And as we figure out, okay, they may have problems with certain foods that's causing the inflammation in their gut. We take out those foods and we find that many of these children get better. And again, that's an example of a connection where we recognize that there is a connection between the brain and the gut, our digestive system. And because basically the pain that they're experiencing, the inflammation in their gut, is causing problem behaviors. And that can actually cause imbalances in the neurotransmitters or the brain chemicals. So there's a brain chemical called serotonin that is very important for helping us to feel, it helps us, it's like the happy neurotransmitter or brain chemical. It helps us to feel relaxed and happy and satisfied and content. And so many children with autism don't have enough serotonin. And that's also the case in anxiety or depression, where people don't have enough serotonin. And most of the serotonin in our body, guess where it's made? It's actually made in our gut. And so if you have imbalances in your gut, then that can actually cause problems with not making enough serotonin. And that can lead to anxiety or depression, or it can be a contributing factor in autism, or even things like OCD or Tourette's, or a number of other conditions. And kind of going back to the example with autism, so many of these children who are aggressive or self-injurious, when they go to their pediatrician or developmental pediatrician, they'll often be given a prescription for an antipsychotic medication to sedate them, so that they're not as aggressive, which can be important in cases where they are a major threat to themselves or to the safety of others. Or behavioral therapy could be used. And I'm not against those, but those shouldn't be a substitute for trying to figure out what's the underlying cause and trying to resolve that. And that will often lead to much more long-lasting effects. And I've seen a number of children with autism who are very aggressive, or who were very aggressive, or were self-injurious, and most of them, we've gotten all of that resolved, where they're no longer aggressive, they're no longer self-injurious. I just saw a boy in my office the other day on Saturday that the first time that he came to the office, he actually spent the whole first half hour of the visit screaming and crying and trying to attack and hit his mom. And during that first visit, we actually had to the dad had to take him out of the office because he was just screaming and crying the whole time and trying to hit his mom and bite her and attack her. And we couldn't even talk because we couldn't hear anything over his screams. And they first started seeing me several months ago. And he just came back into my office on Saturday, and he just seems like, a happy kid. And we're still working on helping him with his language and some of his behavior, but he's much, much better than he was before. He was, sitting on the floor or going on the massage table, playing with toys appropriately, talking to his mom, talking to me. He was happy. He wasn't trying to attack her or bite her or anything. So all that has gone away. And there's still challenges and still things we're working on, but a lot of that real aggressive behavior went away as we treated the underlying causes. And so, let's see. So I saw some questions from Sophia. How do you know if it's a hormonal issue, and which hormone is it? And could it be thyroid or adrenal? Does testing the gut give you enough info to figure out what's affecting the immune system or the thyroid? Yeah, so definitely there are tests for thyroid and adrenal function and gut issues and the immune system. So I will usually based on the person's symptoms and based on what they're reporting. And when I do a lot of digging to try to find out what could be underlying things, when I ask questions, I'm looking for signs and symptoms of, are there signs and symptoms of thyroid or adrenal problems or hormonal issues? And so I'll use that to kind of guide testing to see which tests are most important, those kind of things. But the tests are very helpful because that'll basically tell us where things are imbalanced. And then from there, we can really see, how systems are interrelated. So, yeah. And so that's an example of how I might treat a patient with autism, that we're working, for example, on balancing the gut or balancing hormones or other kinds of things to help their brain to be able to work better. Also when I talked about autoimmune disease, that, I usually don't do things that are suppressing the immune system directly. I will use homeopathic medicines that are balancing the immune system. I will typically look to do some nutritional testing to test for vitamin D or copper or zinc or other vitamins that are really important for keeping the immune system balanced. And so if someone doesn't have enough of those vitamins, then their immune system can also tend to be off. So I'll do testing for that. I'll often do testing for the gut or looking at testing for hormones. So we're usually looking at all those kind of things as a way to balance out the immune system. And we're almost always working on changes in diet. So that's another way that I will treat someone, often with autoimmune disease. And I'll also test for toxins like heavy metals, like lead or mercury or arsenic, or other kinds of toxins that can affect the immune system. So that's another thing that I'll usually look at. And another thing that we might do in terms of autoimmune disease is that we might do acupuncture as well, because that can be helpful in terms of balancing out the whole body. And so those are just some examples of how I might treat someone with an autoimmune disease. Whereas most of the time in conventional medicine, again, it's usually drugs that are suppressing the immune system. And that can cause problems because when you suppress the immune system too much, our immune system normally is supposed to protect us and fight off infections like bacterial infections or other kinds of diseases. So if you suppress the immune system too much, then people tend to get sick more often. And then when they get sick, that triggers the immune system, their autoimmune disease flares up, and it just becomes this really negative cycle. Again, I'm not opposed to the use of pharmaceutical medications. There's certainly a time and place, and they're important, certainly in certain situations. But I just think that there's a lot that can be done in terms of really trying to work on balancing the immune system and helping people to be able to get better by treating these underlying causes. So what have we covered today? So first we talked about that there certainly is a role for conventional medicine, and that I will use pharmaceutical medications when I really feel that they're absolutely necessary. But that naturopathic medicine emphasizes the relationship between all the elements of the body, the organ systems, of course, but also our emotions and our psychological makeup. So I will often address that and talk about stress management techniques or meditation or deep breathing, or I'll do acupuncture to help people with balancing out emotions. Most people don't realize that acupuncture can actually be helpful for when there are difficult emotional things going on. The time spent is another big difference, since I'm really seeking to understand the whole person and treat the underlying causes of the health problems. And then finally, with naturopathic medicine, educating the patient is a vital aspect of treatment. So I want people to understand how their body works, so they are empowered to be better stewards of their own well-being and that of their family. So I thank you for being here again. I appreciate the opportunity to let you know about some of the important differences between conventional and naturopathic medicine. And I actually just wanted to read you a quick thing from our mission statement. So this is my mission statement. And so it talks about here, so it says that our mission is that we're here to heal. So by removing blockages to the body's ability to heal and providing natural medicines to restore strength and balance, we work in partnership with our patients to bring them health and well-being. That we are here to educate. So along with proper treatment, we believe it is important to be good teachers. So we help patients understand how the body works so that they can become better stewards of their own health and well-being. And in addition, we use our digital platforms to provide vital cutting-edge health information for both our patients and the entire community. And the last part is that we are here to empower. Let's see. So, just trying to get it. So as patients, we use our natural remedies and apply our health information to create a daily practice that forwards their well-being, and they're empowered to build and maintain the best health possible for themselves and their families. So that's our mission statement, and I'm happy to share that with you guys. So again, if you would like to talk with me personally about any health concerns that you have, we do, again, offer a no-charge phone consultation for people who are interested in talking with me about a medical condition. So it's really easy. Just call our office at 808-425-2987, and you'll also find the contact information in our Facebook page. And also another thing is that we had our Facebook Live event previously talking about the business wellness programs that we're starting. So if you are part of a small business or know someone in a small business who would like to talk with me about arranging ways that I can help employees and companies through workshops be able to get healthier and help companies save money in the process, then you can also call our office and ask us about our business wellness programs. So you'll find our contact information again here on our Facebook page, and we'll be seeing you in 3 weeks from this time rather than the usual 2. So again, our next Facebook Live event will be in 3 weeks. Okay, mahalo. Thanks for joining us. Aloha.